Hello, teeny internet friends. I am not your mum, and I am not your doctor, but I am a doctor, and the team at Not Your Mum have sent me a list of questions that they thought you might want to know the answers to, so I'll do my best.
Hello, we are Not Your Mum. Dr. Laura has answered some of the questions that we put to her about what is normal during puberty, so what the most sort of common things that she gets people coming to her about.
Over to you, Dr. Laura.
It's a difficult one. It's very easy to tell you what is totally normal, but what's normal for one person sometimes is abnormal for another person. So if you're worried about things, I speak for all of the GPs. We're quite happy to see you the first time and just hopefully relieve some of your worries about certain aspects. Mostly for young people, we tend to see body issues, body image issues. So things like lumps and bumps, lopsided boobs, zits, hair growing in funny places. It's all a bit of a weird and wonderful world when you're going through puberty and kind of discovering what this body is turning into. So if you're particularly worried and things aren't settling down, and I think probably seeing the GP is pretty reasonable. Quite a lot of people worry about their bits down below. Nothing is normal about them. 100% nothing normal. So if that's the bit you're worried about, and you come to see the GP, the vast majority of the time we will tell you that they are normal for humans. So some normal things that girls tend to come see me about is lopsided boobs. Now, predominantly they do even out as puberty goes on. Some ladies will, particularly with their hormone cycles, will get lumps in their boobs, and they normally feel very smooth, and then when you push on them they kind of shoot away from your fingers. Most of those are absolutely fine. They're called breast mice, making illness cute, but they tend to go down again once your period goes, and you kind of go through a monthly cycle of a boob lump coming up, and then it'll go down just as your period comes and your period goes. So they're kind of normal. If you find a breast lump that comes up and then doesn't go down, that's more worrying, and we definitely want to see you. Or if it feels very hard and craggy, we definitely want to see you. Now, nasty lumps in young ladies are virtually 99% of the time totally innocent and usually hormone related. So I wouldn't get too worked up about it, but honestly, even if you think it's nothing nasty but it's just there and you're worried, go see the doctor. We'll hide you behind the curtain and then have a feel of the breast. Also, whilst you're there, we'll teach you about self-examination. If we don't automatically offer it, ask us about it, and then you can be more confident in checking your own body and kind of going through the process in the future and kind of finding out what is normal, and you're much more aware then of if something does change. Now, boys also come to see me about lopsided boobs, particularly teenage boys when you hit about 13, 14, sometimes a little bit earlier. Boys can also get breast growth, and that is part of their normal hormone profile. So as girls' hormones change, boys' hormones change as well, and some of the boy hormones are related to girl hormones, and it means that the breast tissue can also expand a little bit. So you might find some young guys will have slightly bigger breast tissue, so it doesn't quite look like a peck. It is a bit spongy. It does not mean that you're going to grow boobs. I promise you now, you will not grow boobs overnight. They will be there. Sometimes they're a bit lopsided, sometimes they are symmetrical, but honestly, over the next few years, they will even out, and then that kind of squidginess will go away, and you'll just be left with a normal man chest. Not many people are left with them forever. So on the whole, come get it checked out with us. There's a few other things we want to look at, but the vast majority is normal. Don't freak out. You are not growing boobs.